Hi Eric, it's good to see you again. Listen, I've got some good news. You did the right thing by coming in. After reviewing your x-ray report and going over the results from the series of tests, I feel very confident that what you have is treatable with chiropractic care. So the good news is you're in the right place at the right time. Now, because you do have a chiropractic condition, I would like to tell you a few important facts about chiropractic before we get started. As you may remember from the video we had you watch, chiropractic, it's not new. It's not experimental. It actually has been the successful choice of treatment for cases just like yours for over 100 years. Now, had it not been so successful, it would have disappeared years ago. But fortunately for us, the opposite is true. The results of chiropractic care have been so successful and so popular that we are now ranked the second largest healing profession in the Western world. But the important thing for you to know, and all of this is pointed out for you in this report you'll be given to take home with you, is that a study reported by WebMD on millions of patients over several years, we have a 95% satisfaction rate with our patients. 95%. In the medical world of the health profession, it would be near impossible for them to have a better success rate or better record than that. So you can feel confident that you have come to the right place and finding the solution to your problem. Okay, so let's talk about your condition. Why are you having this pain? Or maybe why do you feel this way? Well, first of all, it's not just from one single event, not from one wrong twist or turn or even lifting something heavy. Forget that. It actually didn't even start when you first started having this pain. It has been accumulating over time and is an accumulation of all the events in your life that have been hard on your structural system. In fact, it actually began with the trauma of childbirth. It continued throughout your childhood and even into your teenage years with the hundreds of spills, falls, and accidents you experienced then. Now, let's add the lifestyle you had to that now. Eric, I couldn't tell you how many times you've had improper lifts or physical traumas throughout your adult years. And that's why I say it's not just from one single event. It's years of wear and tear that, if you think about it, really have had absolutely no prevention, no treatment, no care, and really no effort whatsoever to offset that wear and tear. Some good examples of this would be, can you imagine if from childbirth to now you had never been to the dentist or ever brushed your teeth? Can you imagine the condition your teeth would be in? Ugh. Or what about never having your tires balanced or rotated or even properly aligned? I mean, a blowout would be inevitable. So, okay, so that's why I say this isn't just from one single event, it's years of wear and tear. You have had an innumerable amount of nerve damage and tissue damage that virtually have been left untreated. So you are very fortunate that you were only in the pain you are currently in now. So what is the result of all this untreated activity and damage? Well, the result is that your spine has spent years being pushed and pulled out of alignment from the many activities of your lifestyle, applying pressure to these discs, squeezing them even closer together, causing less flexibility, swelling, irritation, and even pinching down on these nerves that flow from those vertebrae. The technical term for this is called a subluxation. Your nerves are being pinched and prohibited from performing their normal activity, which is being able to communicate with the rest of the body. If you study this chart here, you can see the many different kinds of problems that can occur when a subluxation is present in that particular region of the spine. I actually think you'll find this fascinating. Your nerves run from your brain and communicate all the brain's commands to all the organs and other parts of the body. This is actually how your body knows how to function. Now, if you cut off that communication between the body and the brain, your body then loses its function. A pinched nerve is much like the effect of a pinched water hose. The water flow is stopped. This is how your nerve flow is stopped, cutting off that communication between the body and brain, resulting in disease. A subluxation can cause more than just neck pain and low back pain. It can actually cause many different types of diseases. As you see here, there are 4 different phases of spinal degeneration. Just for a condition that you're more familiar with, like cancer, the longer you let it go, the more severe the condition becomes and the more severe the health stage gets. And that's why it's so important for us to start treating and preventing any further stage from ever developing. Right now, with you being pretty active, I would put you at about phase 1. Okay, I think we've talked enough about that. Let's go ahead and look over the x-ray report. Now, since you can't take this report home with you, I'm going to go ahead and circle the picture on this page that best exemplifies your current stage and condition that you are in now. That way you have something to take home and show your spouse or even your family. All right, and as you can see in this X-ray report, it says, for instance, a subluxation is present at C2. Well, I'll tell you right now, C2 is the second vertebra in your neck. And whenever it says a subluxation, you know what that is because we just talked about that recently. A subluxation at C2 is actually one of the main components of causing headaches. Another one of the reasons that brought you in here today. So we're gonna go ahead and address that in the next part. Now, I think we've talked enough, like I said, about your condition. So we're gonna move on to the next part, probably the most important part for you, the solution. Eric, I pointed out to you that the cause of your health problems is not just from one single event, one wrong twist or turn. It's not something that you just did yesterday. Just as you did not cause this problem in a day, we're not going to be able to fix it in a day. So we will set you up for a series of treatments, something we call adjustments, where we will adjust your spine, bringing it back to that proper alignment. Now, the truth is, your spine has been misaligned for so many years that it actually thinks that misalignment is normal. So what we're going to have to do is retrain your spine. We will adjust your spine, and frankly, it's going to readjust right back to where it's used to being. So we will continue to adjust your spine, trying to bring it back to that proper alignment. And that's actually why the number of treatments or adjustments that we have prescribed for you is so essential to follow to a T. Don't miss any, so we can get that spine back and your restoration back to you. The timing and number of treatments is so essential for your health and restoration. Now, as you can see here, I've divided your treatment into 3 different parts. The first phase of care is obvious, pain relief. We want to get you out of pain as quickly as possible. Now, I know everyone responds a little bit differently to care, so your first phase of care will consist of visits every day this week, and then we'll back it off to 3 times a week for the following 2 weeks. At that time, I feel very confident that you're going to be feeling pretty good, probably even out of pain, and you're thinking, yes, great, problem solved. Well, I'll tell you right now that's not the case, because you are in an extremely unstable state. That one wrong twist or turn could set you back to where you are now or even further, and then we'll have to start this process all over. And that's actually why this second phase of care is more important than the first phase, the stabilization phase. We want to stabilize your condition so you don't have to be in that fragile state any longer. But before we put you in this second phase of care, we want to make sure you're ready. So we will do a progress exam to make sure you are ready, and also to check and see if you need less visits than what we originally thought. And if so, we would be more than happy to do that. If we do feel that you are ready to move into the second phase, we'll go ahead and graduate you up into that phase. And then this phase is much easier on you because I will need to see you for a series of adjustments of only 2 times a week for the following 3 weeks. At that time, because I've treated many cases just like yours, I feel that you will be stabilized. And again, we'll do another short progress exam just to make sure that's the case. And if so, you can move on to the third phase of care, the prevention phase. Now, why is the prevention phase so essential for your health and well-being? Well, Eric, I do have one problem in treating your case. We haven't eliminated the cause yet. You are still doing the things that caused you to come in here in the first place. You are still causing subluxations. Just like with your teeth, when you go and get them cleaned, wouldn't it be great if they could stay that way? But unfortunately that doesn't happen because that would mean you could never eat again. And that's just not going to happen. So you have to keep up with them. You have to keep having them maintained, cleaned, checked every 6 months, what be it. Just as you're not going to stop doing the activities that cause spinal degeneration either, and we don't expect you to. But instead, don't let that wear and tear get to the point to where you can't move anymore. And that's actually why we are providing these treatments to you that will counteract that wear and tear. Prevention is so much wiser than overhaul, and wellness care is so much better than sickness care. Now, before we go ahead and start this treatment plan, I do need a few things from you first, because obviously wellness is something you want, wellness is something you need, and we're willing to provide that to you. So first of all, I will need you today to go ahead and schedule all of these treatments that we have outlined for you here. And then secondly, because like I said, timing and number of treatments is so essential for this chiropractic to work for you. Secondly, I will need you to attend one of our special experiences that we offer here. It will benefit your health and well-being, and it happens to be a topic I know you will much enjoy that will benefit you for the rest of your life. It's health information you've never been taught before, and it's called How to Stay Young for the First 100 Years. Now, we offer this presentation 2 times a week. It's a short 15-minute presentation, just you only have to do it once. We like to couple it with one of your next adjustments coming up. And like I said, we offer it 2 times a week on Tuesdays at 5 and Wednesdays at 9:30. Which one of those times works best for you?
5.
Okay, great. I'll go ahead and write that time down here. And then when you leave today, you can go to the front desk, and as you're scheduling these adjustments, give this to Ashley at the front desk, and she'll see this time so she can try and schedule an appointment that coincides with that. And that way we have a reservation for that time. Also, if you have any questions about financials, she'd be more than happy to go over that with you then. So I'm going to go ahead and sign here, stating we went over all of this, and I've made all my recommendations I suit best for you. If you'll go ahead and sign on this line, stating we went over this, you understand it, and you're going to make every effort to comply with this treatment plan, okay?
Yes.
Perfect. Oops. Awesome. Now, unless you have any questions for me, I'm ready to get started with your treatment. Are you ready?
Yes.
Awesome. Okay.